I'm going to talk about the healthcare issue. I'm only going to talk about this because I think it integrates some of the ideas from Harari, Fukuyama, Kaufman, and Lakoff. Lakoff tells us it's all about the way we frame the argument. And if we frame an argument about healthcare that involves insurance, then what we're really doing is we're putting the argument into this individual kind of responsibility, individual versus the insurance industry or whatever. But it's an individual responsibility. However, if we actually frame the whole healthcare into something more, looking at it as if it is a public service, then we're looking at it the way we should support healthcare is similar to the way we support police and fire. And since government is all about the wishes of the group, that's what we should be looking at. So I'll just hold that thought for aside for the minute. And let's look at the fact, Harari tells us that the big brains created early birth, which necessitated some medical help to prevent massive deaths at birth, okay? And so the question is, when does this medical help stop? And how should we do it? And is it a public issue or is it an individual issue? So is there an individual responsible or should it be a public service? Now, another way to look at this idea is when Harari talked about cognitive dissonance, he mentions that cognitive dissonance has to deal with there's a cognitive dissonance between, say, liberty, which is rule-based, and equality, which is basically services-based. And so the liberty side is the individual side, and that's why you have libertarians really fitting on the liberty side. The public service side is the equality side. So the question is, there's a difference there, that cognitive dissonance, but it can be breached. And does it require violence? And the question is, can we do it without violence? Does it have to be so radical? And so what we're talking about here, if you think about it from the Harari perspective of where meaning is, we're looking at the ought in terms of what ought to be the case. And should the ought fit somewhere in that compromise? And so the whole idea then is government is all about compromising. Governing is all about compromising. And so, governing is something that focuses on the big group. And so why can't we develop it as a compromise? And think of it something along the lines of, say, education, where we pay for from first to 12th grade, but people pay for their own education beyond that point.